In 2015, the trustees of the Himalayan Trust UK decided to expand their programme from improving education standards in the Taplejung District of Nepal to looking at what could be done to improve the health of the communities in the rural areas that we serve. HTUK has two trustees with a particular interest in health. Dr. Debbie Eklund, pictured in the middle right here, who has a vast experience in public health, and Dr. Kate Kierhain, middle left, a GP who has been out to Taplejung District on 3 occasions. They work closely with a public health consultant in Nepal, Dr. Jangmu Sherpa, who together with her husband Lakpa runs an NGO, Action for Nepal. The health project started by carrying out surveys on villagers' needs and views in 3 remote villages in the Taplejung district back in 2015. It is an important principle of our charity that we do all we can to understand and meet the wishes of the local people rather than imposing our own ideas. At that time, most of the villagers were going to the Dharmi, or faith healer, as the first point of contact when ill. It was apparent that Yampudin was the most needy of the villages. On our field trip in 2016, we were alarmed to hear from the villagers in Yampudin that over the previous decade, 1 woman each year from the village and its surrounding homes had died in childbirth. At that time, most women were delivering at home or in fields without a skilled birth attendant. The health post had no permanent staff, and because of its isolation, staff did not want to stay more than a few months. In the event of a medical emergency needing access to the hospital in nearby Phungling, patients were carried on a stretcher for a long day's walk and then a 6-hour bumpy jeep ride. There were very limited supplies of medication. The strongest painkiller provided by the government, for example, is paracetamol, which would have to be used in labour or with a nasty fracture. The majority of villagers in Yampudin felt that in order to improve local health services, 3 main things had to be initiated. Firstly, a birthing centre. Next, availability of medical equipment, and then a better health post since their present building had been damaged by the earthquake. A local woman offered to donate her land for a new health post. A big fundraising effort was made by HTUK, and in 2019, a new health post with a birthing centre was opened. Since then, there have been no maternal deaths in Yampudin. Action for Nepal have worked with the local management committee in Yampudin and initiated training for them so they can manage the health post themselves. We have a field officer based in Taplejung who visits the health post regularly and besides helping with training, collects data on illnesses. HTUK provided the training for 2 local girls, Tika and Mina, to be health workers, and they are now back working in the village. We initiated an emergency maternity fund so that travel expenses could be paid for any pregnant woman facing an emergency. We have initiated a community health awareness programme in order to inform villagers on how to try and improve their health by making their own decisions. Nepal relies heavily on community health volunteers to go out to villages and speak to mothers' groups in particular to inform communities about health. We have provided training for these volunteers in Yampudin on such subjects as maternity care, danger signs in pregnancy and the newborn, and serious illnesses. Having completed this programme of health awareness in Yampudin, we've now moved our programme to the village of Lelep, where we have already provided management training and contraceptive training. The ongoing challenges we face are these: recruitment and retention of staff. All the health posts are understaffed. For many years the government has placed staff in remote areas, often several days' travel from their own homes. This situation is improving, but health posts are generally understaffed by around 30%. Next, supply of medical equipment. Next, buildings that need repair. And finally, funding. On our recent field trip, we were aghast at seeing a couple of satellite health posts where staff were clearly very isolated and not maintaining standards of hygiene. It would be great if we could spread our work to try and raise standards in other remote villages in the Taplejung district. We do, however, remain optimistic. The local communities are keen to work with us. A heartwarming moment in our recent field trip was meeting Ranjita, a local girl to whom we gave a scholarship to be trained as an assistant nurse midwife, and she's now working in a very remote village near the Tibetan border. She had walked for 2 days to meet us and to thank us for all her training, which her family could not afford, to enable her to have a job which she enjoys and in which she's making a difference in the community where she is working.